And Dr. Darien Sutton joining us now with a health and wellness question that's on your mind. And here's that question. When should I see a dermatologist about a rash? What's normal and what's not? That's from Amber Kay.
So there are some key questions when I'm examining someone with a new rash that I ask. First and foremost, how did it start? How long has it been going on? When do you see a doctor? There are some key signs. If it spreads around your whole body or if it spreads quickly, which is why I always tell patients, take a photo on your phone of what it looked like 2 days ago so that I can have a better understanding of how rapidly it's progressing. If it's associated with a lot of pain or if you see any signs of infection, which can include redness, swelling, or increased pain around the site, those are reasons why you need to see a doctor.
I love that. I totally texted you with a picture of a rash on my kid, so he is the go-to for it. And your prescription for wellness today?
It's really figuring out what you need to ask before you have an increase or an important procedure or a surgery.
Like any surgery?
Any surgery,
okay.
Any procedure. I think that these notes are really important, especially when I'm doing a procedure in the emergency room. I stop, you have to ask these questions, and I always feel patients. They feel like they want to ask another question, and when I feel that, I have to stop what I'm doing and really reassess where we are, because sometimes if you go into those moments without questions answered, you'll have an outcome that you don't want. So there's some key things. Number one, discussing risk and benefits and complications of the procedure, what you will need when you go home after the procedure, and then also when you can resume normal activity. Mainly, if you're a physically active person, if you're running 3 miles a week, you want to know exactly when you can get there, because if you don't, or unfortunately, if you don't have that outline, then it may be more difficult for you to get there.
You know, that's so interesting, because I think a lot of times, depending on the surgery, obviously, people can think, oh, I feel okay. Yeah. I'm thinking about like post-pregnancy or something. After you have a baby, oh, I feel okay, but your body maybe not is actually okay, so you've really got to take your time.
And that's why it's so important to ask those questions. When will you feel yourself? Because so many patients will be 2 months after their procedure and they don't feel 100%. And if you don't have that information beforehand, it can be really jolting.
Thank you, Dr. Sutton. And you can submit your health questions to us here at ABC GMA 3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.